Yeah, so we're recording now, and and you said if we like the conversation, we can put it on YouTube. So thanks for letting me know.
No worries.
All right. In the meantime, oh, and by the way, do you want me to also allow my AI assistant to come into the chat and take notes and send you an AI summary of the meeting, Jacob?
Yes, please. Yeah, that would be good. Yeah, thank you.
Okay. So my AI, it's struggling, but it's in the chat. It's called Ron's Note Taker.
Okay.
All right. So what's going on, Jacob?
Yeah. Well, I didn't realize. Well, I've had some. How much actually? But I've got. Yeah. Obviously, I've got some issues that have been long-term issues. I didn't know that I had necessarily until more recently that I've been suffering from. Obviously, to do with my jaw, my maxilla, and everything. Yeah, I thought that mewing would help. I've been mewing for a while, or at least trying to. And I thought that would help, bring my jaw forward and stuff. But then when I learned more about, the maxilla and about, your jaw and your palate and everything, I realized, yeah, I've got a high arch palate is my main issue. So I don't have enough room for my tongue to properly sit on the top of my mouth. So I've got quite bad scalloping, and I can't breathe as well through my nose as I would like to as well. I mean, I can breathe through my nose, but it's usually, it's only through one nostril. So it's not very efficient.
How old are you, man?
I'm 20. I'm 20 years old. Yeah.
Where are you located?
I'm in Oxford right now. I'm at university, not Oxford University. I'm at Oxford Brookes, doing a motorsport engineering. But yeah,
That's
so
cool.
Oh yeah, there. So yeah, I'm at university right now. I'm in the uni house with a few mates. But yeah, located in England, so not so many good places for dentistry and all that.
Expansion.
Yeah.
England is kind of a dead zone for expansion.
Yeah. No, I've seen a few of your other interviews and stuff, and yeah, that's what I've gathered from that. I'd be looking at going elsewhere. So yeah.
All right. So how would you like to proceed? Is there something specific you want to talk about? I acknowledge your issue. I see you've basically self-diagnosed. You're telling me you have a narrow palate, poor nasal breathing, and lots of suffering that results from that. I hear you. I've been there. Most people I talk to are in the same position. Where would you like to go with that? Do you want to talk about paths forward for you? Do you want to talk about anything in particular about that?
Yeah, I mean, MSc is what I've been thinking about really, as far as what that could do for me. I think that would probably be the best option. I mean, if MSc, but MSc when they cut your jaw as well, the top jaw, I can't remember what's that called again.
The mid-palatal piezotome.
Yeah.
So at your age, whether or not you need that is debatable. A scan would let us know for sure what the bone looks like in there, whether or not maybe you can get away without doing it.
Okay.
But certainly it's an option, but it's not necessarily totally required. If that were a deal breaker for you, we could probably get around that. Depending on the provider and depending on the appliance being used. I mean, it's always a gamble, man. Expansion is always a gamble if you're not using a piezotome osteotomy or some other type of surgical assist.
Yeah.
Sometimes the gamble works, sometimes it fails, and you have to change out your appliance and do a surgical assist to get over the hump of the mid-palatal suture. At your age, it's kind of a coin toss.
Okay. So would it be worth waiting a bit till you're a bit older to do that, or is it?
Why would you wait? Would it be inconvenient for you to seek treatment now?
I don't think so. I think it's kind of a good time right now. I mean, I could travel. I could make, I'm at university, but like I can, I can fit things in around that.
Yeah, man. There's no reason to wait.
Yeah.
Your waiting is only going to make it harder. When I said that a piezotome is a coin toss for someone your age, I mean your bone could potentially be thin enough still and soft enough that you don't need it.
Okay.
Not that a piezotome is more dangerous for someone your age. It's not. It's just maybe less necessary. So with MARPE, pretty much as soon as you enter adulthood, the sooner the better to get it done, because the bones only get more stubborn the older you get.
Yeah, yeah. And also I've got some pictures as well of a bit closer up. I took some of my teeth today.
Can you screen
Just,
share them?
I can, yeah, I can get them up and show you.
Yeah, fire it up.
I think they should be on here. Yeah, yeah. So if you can see, yeah, so if you can see, this is me with my teeth fully closed.
Yeah,
And yeah,
kind
you
of
can
a
see the
deep
dark patches around the sides there. So yeah, and my jaw's kind of a bit strange. So I've been trying to, like, I guess, realign it with my posture, just with my resting posture. But when I do that, I just scroll. So this is how it is when it's real, when I mean, it's not my actual bite, but this is when I'm like using my proper tongue posture and trying to move it across, but like trying to realign my teeth, but it's kind of a bit wonky. Like this side, it doesn't touch, like on one side of my mouth.
Yeah, your
So
left
it's
side.
not, yeah, and that's not how my bite was. Like as a kid, I wasn't biting like that. So but I got some more pictures. I got more pictures of me and my sister as well, because
Yeah, feel
that's
free.
kind of how I realized that I had some issues compared to her, especially because she developed more properly. Like she has a proper like a proper dental arch. Like she's got a nice wide jaw compared to me.
Mm-hmm.
And I realized why that is as well. So that's me with my mouth open, and I've got the other issue as well is bruxing. I got quite bad bruxing, and I guess that's just from not getting enough air in my sleep and stuff. So I've been grinding my teeth a lot as a kid, and I think I still do probably. So yeah,
You have
that's
upper
another
mandibular
issue.
joint pain as well, or just grinding?
Yeah, I have had pain. Yeah, I have had some bad pain sometimes. It's gone away at the moment, but I have had some pain with that. Yeah,
Is
so
it
that got
muscular
me
pain
worried.
or is it pain in the joints?
Kind of both. Kind of pain in my teeth and my gums as well. It got me worried. It got me quite worried. So that was when I was like, yes, I've got to like do something about this because it's probably going to get worse if I don't do
Yeah,
anything.
yeah.
Um, and also my wisdom teeth haven't come through yet as well. So
I
I
see
don't
you
know if
haven't
they
had
will.
any extractions.
No, no, no.
Show me your
Uh,
side profile on the camera.
yes, it's not the best. It's not good.
It's not the best, but it's also not horrible either, man.
Mm,
You got a little bit of angularity in your face.
a little bit, yeah. I mean, I wasn't a mouth breather, so I didn't have that as an issue.
Show me
But
your
I was.
smile on the camera.
It looks better than it does in real life because the depth isn't the best. So you can't see, like, again, this picture as well. You can't really see how bad it's. It looks wider than it is. It is narrower in real life.
Show me more pictures. Do you have any
Okay.
pictures of the roof of your mouth?
No, no, I don't. I mean, I can try and show you.
Yeah,
I
show
can
me the
try and
roof of
show
the
you
mouth
here.
on the camera. You're missing. You're too high. Come down.
Okay.
Yeah, there. Now lean back a little bit more. Can't. It doesn't look. Yeah, it's. What have you measured it? It looks what, like a 32, 33?
Yeah, it's pretty small. I mean, it's like at the front, it's just, I mean, two of my fingers.
Yeah, the
Yeah.
front is okay. I mean, it's normal to be a little bit more narrow there,
Mhm.
but the back doesn't look horrendous. I've
No.
certainly seen worse.
Hmm.
Not saying you're not a candidate for MARPE, but it's not like you know, like, oh my God, how's he even living with the palate so narrow? It's not like that.
Yeah, yeah, yeah.
It looks like a 32 or a 33, which is lower moderate narrowness.
Hmm.
Like I was like a 35 when I started. So
Okay.
a couple millimeters bigger, but not that much bigger.
Hmm. And I can show you some pictures of me and my sister as well,
Yeah, sure.
because that kind of shows the comparison. Um, yeah, so here's us. I was about 14. She was probably about 13 there, and you can just see she's got a much wider mouth than me. And her maxilla is a bit better than mine as well. And
How did that happen?
I actually figured this out. When I was younger, when I was very young, I used my mum tried to, well, she tried to give my sister, but she did give me the dummy. You would call it the pacifier in the US, a pacifier. Um, but I got hooked on that, so I was using that all the time when I was a little kid, and they had to wean me off it. They had to get rid of it. So one year at Christmas, I had to chuck it away. I had to give it away to Father Christmas to get rid of the dummy because I was too hooked to it. But she would never take it. She'd never take the dummy. So that's
Wow.
why she developed properly, and I didn't. And
Do
I
you
realized that,
remember? Do you remember
yeah,
when they took it away from you and gave it to Father Christmas?
yeah.
Was it a
I do.
difficult time in your life?
Yeah, no, I was distraught. I mean, I really liked that.
How old were you?
Um,
Oh, 4 or 5? Were you older?
yeah, I was like 2, 3, maybe.
Okay.
Yeah.
Wow, man.
So
Wow.
yeah,
And
and
then
you
so
can see,
the pacifier prevented you from the pacifier made your palate high and vaulted because essentially the nipple of the pacifier was pushing up into your palate and causing it to shape in that high vaulted way.
yeah, yeah, and yeah, so that kind of caused me all these issues now, all these years later. Um, and I don't know, no, it's not my parents' fault. Obviously, they didn't know, but yeah, I mean, I
How
know
did
it
your sister turn
now.
out?
She's pretty healthy. I mean, you can see her here. She doesn't look that much different from this picture here, really.
Yeah, she's got a good
Um,
jawline.
so yeah, she looks a bit better than me. With that, yeah. I'll just get another picture as well. Yeah, this is us when we were a little bit younger as well. It's not as good as the other one, I don't think, as a comparison, but you can kind of see me there. You can see I've got a bit of a flatter, narrower
Yeah,
face.
just look at the size of her closed mouth versus the size of your closed mouth.
Yeah. You can really
And look
see
at
it.
the eyes. Look at how relaxed her eyes are versus how like squinty your eyes are.
Mm, yeah.
And then look at the shadowing around her jawline versus the shadowing around your jawline,
Yeah.
right?
No. Yeah, I can. Yeah, I mean that's what I had to look back at these pictures because I realized that, and I looked back at them and I realized I had all these differences and stuff. Yeah, even back then.
Right, right. All right, man. I think I understand. What else would you like to show me, and what would you like to talk about next?
Um, yeah, well, I think the next thing really would be like whereabouts I could go for treatment or like what I would do with that. Because obviously I mean, I guess Europe would probably be the best place to look for providers for this sort of thing.
Yeah, man. Someplace you could take a train to potentially, right? Or a short flight
Short flight,
on a break from uni,
hmm
right? I'm thinking Danielle Cantarella in Italy,
Okay.
or Chris Moschik in Germany, but he's going to be more expensive,
Mm.
significantly
Okay.
more expensive, like
Mm.
15 to 20,000 euro.
Yeah.
I don't know what your budget is like, but
Yeah.
if you're on a tight budget, then probably Cantarella, you could probably save 5 grand working with him, and he could still get you split and get you a nice expansion.
hmm hmm
Yeah, have you
Yeah.
heard of both of those guys?
I think so. I've heard of the German guy, definitely. I think in some of your other interviews, but no, I haven't heard of the one in Italy. I don't think so.
You could try a couple of UK providers, man. You could try Sunil Harani. You could try Mary Lowe. You could try Stefan Decker.
hmm
These are all UK providers that have used MARPE before. It's just a matter of whether or not they're going to be willing to treat you with it. What
Yeah.
I've seen is that the UK providers are pretty gun shy
hmm
with the
Yeah.
MARPE, unless there's like a very discrete malocclusion that can be corrected by widening the palate.
Yeah. I mean, I don't think, they might look at me and think, he looks relatively normal. That was my worry with the UK guys is about that really. But are you able to just say that some of that stuff again so I could just write it down?
Yeah. So the Italian provider, and I'll put it right in the chat as well, so you can copy and paste it. Italy is going to be Daniel Cantarella. Okay, might be one L. Germany is going to be Christoph Moschik.
Yeah.
Another option for you would be Turkey.
Mm-hmm.
Would be Ayse Cemile.
Yeah, I've heard of her. Yeah, I've heard of.
She's cool. She would definitely treat you
Mm-hmm.
and try to help you out. And she's also very affordable. Like the money you would save, the money that you would spend on travel, seeing her across the continent, would be
Yeah.
more than made up for in the lower cost of her treatment.
Okay.
Okay. And then in terms of UK, you could try Stefan Decker. You could try Mary Lowe. You could try
Mm-hmm.
Sunil Hirani.
Mm-hmm.
I don't think Mike Mew is an option right now. I don't think he's treating any adults right now.
I thought he might be treating adults now, but I'm still a bit unsure about his method of expansion.
He uses MARPE.
Oh, does he? Yeah.
Yeah, he does. He does. You could try. I think the consult is it's a steep price to
Yeah.
talk to
Yeah.
him.
Yeah.
And he's obviously also got a lot on his plate right now with
Mm.
the legal proceedings and all that. So maybe not the best option.
Yeah, that's what I thought. Yeah. No, I mean, yeah, I have some options. I mean, finance wise, I have quite a bit of money that I've saved for this, and I've been given some. I got some, well, I guess sort of inheritance from my grandparents. They did it for all like their grandchildren, just for money that if you like needed to use it for something important, you could do that. And then I've also got a car that I can sell, and I've got some other things I can sell.
Okay.
So I
Yeah.
could,
So
and
in terms of financing orthodontic process like this,
mm,
you're not going to need all the money up front.
yeah,
You're not going to need all 10,000 up front. You'll
hmm
probably need 25% down. So let's call it $2,000 to $3,000 down payment. And
hmm
then you can pay the rest monthly during the 2-year duration of your treatment, which
hmm
is what I would strongly recommend. I would
yeah, yeah,
never
yeah.
suggest anyone pay it all up front, even though they usually offer a discount for doing so. You
hmm
always want to keep some money outstanding to preserve the quality of treatment during the long slog of it.
hmm
So I don't think you're going to need to refinance your house to get started.
hmm
You'll just need to come up with a couple $1,000s,
Yeah,
which
yeah,
sounds doable for you. It sounds like you've got a little bit of a savings account,
yeah, yeah, yeah. I've
which
got
is
that.
good
I
for
can do
you,
that.
man. Good for you, because shit, a lot of adults don't even have that, and so they're financially closed off from opportunities like this.
hmm Yeah, I mean, I figure it's money well spent. I spend it now. It's the rest of my life that's, you know, you can benefit with that stuff. So,
That is the prevailing wisdom here. Okay,
mm,
for sure. It's a expensive process. It's a difficult process. There's certainly some pain and heartache involved with orthodontics and with getting one of these expanders screwed into the roof of your mouth and cranking your skull open with it. However, the results are permanent for life, especially if you're
mhm,
practicing proper myofunctional habits and mewing before, during, and after. You can really stabilize the results.
mhm. Yeah, just another thing as well is uh I mean, I know that there is asymmetry like that comes with it, and I don't
Potentially,
mind. I don't
potentially.
mind. Yeah, I don't mind asymmetry. Like I don't mind a bit of asymmetry. I'm not averse to, I don't mind if that happens. Obviously not too much, but I just want to know like how you might go about trying to limit that as a factor, or like what you might ask for with that.
Yeah. So the first step in preventing asymmetry is screening out cases that are prone to asymmetry ahead of time.
Hmm.
Smile for the camera one more time, Jacob. You're not super asymmetric to begin with. There might be a little
Okay.
bit of asymmetry there, but it's nothing egregious. Maybe a slight maxillary cant coming from the left being the high side and the right being the low side. Nothing
Mhm.
too crazy. Why don't we take another quick look at that? Bite down, smile. Yeah, a slight cant
Yeah.
from top, the left being the high side, the right being the low side.
Mm.
So yeah, I think you're a candidate aesthetically for the MARPE. I don't think asymmetry is going to be a huge issue. Another reason why I think you're a candidate is because what it looks like to me is that it looks like your face could tolerate a little bit more vertical dimension to it.
Yeah.
You seem a little bit compressed here.
Hmm.
And so the MARPE adds a little bit of vertical dimension because whenever you expand the palate in that way, the palate drops down and forward usually.
Yeah.
So the worst cases for MARPE, people that are definitely not candidates, are generally people that have an excess vertical, which you don't appear to have excess vertical. To my, admittedly untrained eye, you have a lack of vertical, which makes you a good candidate from that perspective. You don't have too much of an asymmetry to begin with, or can't to begin with. So then after having done that initial screening, which I think you pass, I think the next question is, what level of experience does my provider of choice have? Because certainly the easiest way to get messed up with MARPE is to work with an inexperienced provider that does not use proper protocols when it comes to designing and placing the appliance, or if they don't have a good level of quality control over the manufacturer of their appliance, maybe because they don't work with the right lab, or they don't know how to check appliances once they come in from the lab, or they're just inexperienced in general and don't catch the red flags that a more experienced provider catches to prevent asymmetry, such as incorrect orientation of the jack screw, the expansion screw, once it's placed in the palate, because that's really the most important part. So just by working with a Christoph Moschik or a Daniel Cantarella or a Isa Chamile, you're already reducing your risk of asymmetry, just because those people have done lots of cases and have seen it all. They all know that asymmetry is a real problem that happens, and they don't like it. They want to avoid it, and they know how to. So, for example, another common way that asymmetry forms and becomes a problem is, well, it forms because these MARPEs also have issues with dimensional stability, which is to say that once you start getting into the later innings of expansion, let's say 5 millimeters plus, the appliance can potentially get distorted just because of all the force coming down on it from the palate, from the skull. And at that point, sometimes the appliance reorients itself in an asymmetric way. And if the provider doesn't catch that, and you turn, let's say, another 3 millimeters into that from 5 to 8 millimeters, that's when asymmetry starts to become a problem. And then let's say let's say this happens under the watch of some doctor in some faraway place, right, in Asia. And you don't go see that doctor for a month while this asymmetry forms. And the bone starts to heal into that asymmetry. Now it becomes a little bit of a permanent problem. Because after about a month of not turning your appliance, the gap starts to fill in with bone and heal, and you get a little bit fixed in that position. So that's how asymmetries really become problematic, a combination of negligence and lack of oversight.
Okay.
So countering those things is how you mitigate asymmetry. Work with a good provider, pre-screen yourself, which we did, and then keep an eye on things as you expand. So, for example, some doctors use apps to track remote patients. There's one app called Grin, where you do scans of your mouth using your phone, and you send it to your doctor once a week. And that helps the doctor keep an eye on how the expansion is going. So if your doctor doesn't have some predictable, systematic way of monitoring you while you expand, that's a red flag.
Okay. And because obviously I'm probably gonna have to find someone abroad. How often will I have to meet with them, or would it be good to meet with them in person?
I think you can do your initial consultations remotely.
Yeah.
Just to save you the heartache of traveling to see someone who's not interested in working with you.
Yeah.
I know Dr. Moschik and Dr. Isa Chamile, maybe even Dr. Cantarella, can accommodate that. If you engage with the doctor, obviously you're going to need to go in and get a scan, an initial scan, so that they can send that scan off to the appliance maker to have the appliance fabricated. The way these appliances are fabricated is based on scans and radiographs that the doctor takes on you. Then it'll be 5 weeks until your appliance is ordered, or rather, till the appliance arrives after having been ordered. So you'll need to be back for that appointment. Let's say 4 to 6 weeks later.
Mm-hmm.
Then, if you're being monitored remotely, you're probably okay for another 4 to 6 weeks, unless something goes wrong. If nothing goes wrong, you just keep going. Maybe you come in after 4 to 8 weeks just to get checked up on.
Mm-hmm.
Then you just keep going, keep expanding unless you have a problem. Hopefully this can be monitored remotely.
Mm-hmm.
Once the expansion stops, now you come in for an Invisalign scan, or you come in to have braces put on.
Mm-hmm.
And if it's Invisalign, then they basically scan you up for Invisalign. They do what's called an iTero scan. Then they can mail you your Invisalign trays abroad. Then it could be potentially, a month or two until you see them again. Basically, you go plug and chug with your Invisalign trays until you need your next scan and your next set of trays, or unless something goes wrong, which things do go wrong. But if everything goes smooth, you can basically see your doctor once every month or two for the whole duration of the process, or less. It's doable, man. Working remotely is doable.
Okay, that's good to hear. I mean, I got to deal with my housemates as well to get the smaller room, so I don't pay bills. Because I got the small room, so that kind of frees up a bit of extra money. I said I'd do that for traveling money. So if I need to travel, I've got that flights and stuff covered with not paying bills as well. So
Good for
that
you,
would
man.
help me out.
You're doing what it takes to accomplish what you want, and I really admire that. You're bootstrapping.
I'm trying, trying to, yeah.
Good for you.
Yeah, the other things as well. My lower jaw as well. Like, would I need anything for that, or because obviously like MSc it's just for the upper jaw. I don't know. I mean, do you want to look at it or
Yeah, bite, smile. Show me your smile. Your lower teeth seem tipped in.
Yeah, they are. Yeah.
Although your upper teeth are also tipped in.
Mm.
So I don't know how much discrepancy you have between your upper and lower. I don't know if your upper is that much narrower than your lower, or if it's narrower at all than your lower. You may need to either limit your upper jaw expansion to prevent yourself from having a catastrophe on the lower, where you need some kind of surgical intervention on the lower to get it to match, or you could consider doing like an SFOT on the bottom to buy yourself a couple more millimeters. But the lower always limits how far you can expand with the upper. And you appear to be someone who might be limited at a lower range of expansion. So just be wary of that. One of the big screw ups that happens with MARPE is overexpansion. Even if it's a symmetric expansion, if you go too far beyond the limits of your mandible, it can cause problems. You end up really having to crank those upper teeth in, or even migrate them in through the dentoalveolar bone to get them to be back into a decent bite. You might be limited.
So would you, and this was something else. I mean, I'm open to this as well, but like some kind of surgery as well, like after the MSc, is that something you think that I could benefit from? Maybe.
What kind of surgery are you talking about?
To bring my maxilla forward.
Oh, a DJS?
Possibly, yeah.
Show me your side profile. Why would you do it? For aesthetics, or do you have some sleep disordered breathing issue that you're concerned with? Why do you feel like you need to come forward? Lack of tongue space? What is it?
Yeah, I mean, I can put my tongue again. I think the MSc would definitely help making a flatter area for my tongue. It's more the lower jaw. If my wisdom teeth did come through down there, I would be worried that they come through impacted. My upper jaw, I think if they did come through, they come through all right. I mean, I don't know. They could never come through because my mum, I think her lower wisdom teeth never came through. Well, maybe they're there, but they're not showing. But yeah, that would be my main concern. Really, is wisdom teeth.
Wanting the wisdom teeth to erupt.
Yeah.
So right off the bat, you should be aware that if you were to do jaw surgery, your wisdom teeth would have to be completely removed.
Really?
Yeah, because the wisdom teeth are in the way of the surgical cuts, especially on the
See.
lower jaw.
Yeah.
So doing a jaw surgery would be an automatic death sentence to your wisdom teeth.
Okay. Yeah.
So you would not do jaw surgery to save the wisdom teeth.
Okay. Yeah. No, that's
Now
good.
yeah, you look like a little bit recessed, but not too bad, man. Not too bad. I think your upper jaw may come forward a little bit with the MARPE, because
Hmm.
the upper jaw does come forward and down a little bit whenever you do a MARPE. That might help with a little bit of the sunken in look of your upper lip.
Yeah.
Could you handle a jaw surgery? Sure. Most of us could. Would it be
Hmm.
a major jaw surgery? Not really. Not unless you were to do a CBCT, a cone beam scan, that demonstrated that your jaws are worse than they appear from the outside.
Hmm.
But to my naked eye, they look decent, and you don't really jump out at me as like a jaw surgery candidate.
Okay.
But to be sure, you would want to do a sleep test
Mm.
and maybe get a CBCT of your pharyngeal airway just to see what that looks like.
Yeah. I mean, I would like to know, because I mean, I don't have the worst sleep apnea in the world. You know, I know there's definitely people out there with worse than me, but I definitely like I do suffer from being tired during the day. Like I don't, and this is something again. It's another one of those things that I didn't kind of realize was a thing that that was happening to me until later on when I kind of found out about the rest of the stuff. But I have always like been, you know, struggled with getting up in the morning and being tired and, you know, getting tired throughout the day and stuff like that.
Yeah. Yeah, yeah. And I think your next step should be to try to understand better what's causing that.
Yeah.
And if you do the MARPE will probably help with that to some degree. And then you'll need to reassess at that point. Like you might be struggling now, but the MARPE might get you to a point where you're like struggling less and in a
Mhm.
way that is manageable forever after that. Now, if
Yeah.
you do the MARPE and you're still choking in your sleep, snoring, having a hard time sleeping on your back, and it's important to you to fix those things, then certainly advancing the jaws would be the next step for you.
Yeah. Yeah.
But from an aesthetic point of view, I would not do the jaw surgery purely from an aesthetic point of view if I were you.
No. Yeah.
Because I think you look good. I think you look decent. Are
No,
you the
thank you.
best? No. Am I the best? No. Is anyone perfect? No. But you're like, yeah, I think your face works. It has a lot of redeeming qualities. I don't think your side profile is terrible. Um, and I don't think your looks will hold you back in life from most things that you would want to accomplish, certainly to the point where you would need to pursue a jaw surgery to like do something about it.
Hmm.
Yeah, why don't we just start with the expansion and see how that goes?
Yeah. 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 That's what I was thinking. Yeah. It's probably the best thing to do, really.
Plus
I
the
think,
expansion and the jaw surgery stack. So like even if you were planning on doing the double jaw surgery, you might still want to do the expansion first and then do the jaw surgery in a couple years once you reacclimate to the new face.
hmm. Yeah. Yeah. Definitely. Yeah. No, I mean, that's good to hear. I mean, I was a little, I didn't really know that you had your, you know, your wisdom teeth removed for that and stuff. I had no idea.
For
Uh,
sure.
but yeah, I mean, I would like to try and keep them if I can. And I don't know. I don't. It's up in the air whether maybe they've already come through down at the bottom. I don't know. Because I've got some stuff I don't know. But they at the top they could come through now. But again, it'd be even better if I had more space for that to happen with the expansion, I guess.
Yeah, the palatal expander might give your upper wisdom teeth some space, but the lower wisdom teeth, you're probably not going to get enough dental expansion to be able to. I mean, the dental expansion on the lower would help,
Mm.
especially if you did an SFOT and you kind of migrated things forward a little bit.
Hmm.
But you're not going to get a skeletal expansion on the lower where you create, several millimeters of new bone where you can slide everything forward into that new space and give the wisdom teeth a chance to erupt.
Hmm.
Definitely not on the lower.
Okay. Yeah. Yeah. No. Yeah. I mean, yeah. That's something I've just been thinking about. But
What, your wisdom teeth? You've been
yeah,
thinking
yeah,
about them? Yeah, man, I get it. There's something desirable about saving your wisdom teeth
Mm,
and getting them to erupt in a nice, healthy fashion. But for most of us, where that's not naturally occurring, it is kind of a pipe dream. At
mm,
your age, it's hard to turn that process around.
mm-hmm,
The best you can hope for is that you just leave them in impacted and hope that problems aren't created where where you create little gaps between the wisdom tooth and the second molar where food is getting stuck, and then you get an infection, and then you end up losing both teeth or some more systemic facial infection as a result of the impacted wisdom tooth. If you can just keep the wisdom teeth coming in at an angle where they're invisible or only partially visible without extracting them, that's a win.
mm-hmm,
You can go a lifetime without having a problem. That's a win too. They don't necessarily need to erupt perfectly. They're still back there doing their thing, holding things forward.
mm-hmm. Oh yeah, I think the other thing as well, uh, was face like
Face
face
mask,
apparatus, face masks. Yeah, face masks. Would that be something that I could benefit from? Do you think, or not really? I don't know.
smile and bite down. Not really, man. Not
Mhm.
really, because your upper teeth are already in front of your lower teeth. You're
Yeah.
not an underbite. You're
Hmm.
not a class 3, and generally, face mask is reserved for class 3 patients. You can use it to just indiscriminately pull your upper jaw and mid face forward. How effective that is debatable.
Mm.
Um, Plus, the MARPE itself has the potential to bring your upper jaw quite a bit forward anyway already.
Hmm.
So I don't think you're a great candidate for face mask.
Okay. I mean, I don't mind that really. I mean, it's quite, it's quite an arduous process with wearing that all the time. So,
Super arduous.
mm,
Super arduous. I tried it and it's miserable.
yeah, yeah,
You really got to have conviction in why you're doing it, and there needs to be light at the end of the tunnel for it to be worth it. And usually, what that means is an underbite patient who's doing it to avoid jaw surgery.
yeah, yeah. No, I mean, yeah, I've got a lot of stuff going on here that I'd like to do. I'd like to go out and see my friends and go to class and stuff. So,
Yeah,
yeah, I don't want to, yeah. So that,
good
yeah,
for you,
that's
man.
good.
Those are considerations. I mean, this is should be a fun social time in your life where you're meeting new people at school and doing, you know, having cool social experiences that are not going to be available to you when you're an adult and potentially have a family.
Yeah, yeah,
So now is not the time to be locked in your dorm room doing a fucking face mask all day,
yeah, yeah, yeah.
unless you really have a good reason to do it.
Hmm. Yeah, that's another thing as well, that I wanted to ask about is exercising with an MSC appliance in. Like, how would you, is that something you should limit? Is that something you should be concerned about? Or, would that affect, if you're going a bit, exercising very hard in the gym, or, lifting heavy weights, or, what should you kind of avoid with that?
You should avoid impact to the face
Yeah.
during until the suture really heals,
Hmm.
which is to say about 6 months after you stop turning.
Hmm.
Um, but normal weightlifting of pretty much any kind, jogging, kettlebells, barbell work, uh, most sports are going to be fine. What you're going to want to avoid is getting elbows to the face, kicks to the face, punches to the face.
Mm.
Football, rugby in the UK, American football would be a no-no during expansion.
Yeah.
Otherwise, man, you're pretty much not limited at all.
Okay, that's good to hear, because I was a bit concerned, that I'd have some issues with that. And oh yeah, also, what's the sort of timeline for this? I mean, I've heard about 2 years for this for the whole process.
Yeah, 1.5 to 3 years is about right.
Hmm.
So let's call it 2 years and change is pretty safe.
Hmm.
Um, Unless things go sideways, then 6-month chunks can very quickly be added on if you have a failed appliance or some other failure. Mostly a failed appliance
Hmm.
can cause a lot of delay because you have to have maybe turn the appliance back, have it removed, wait for a new appliance to come in, try again. You can double the MARPE phase of treatment if the first one fails. Otherwise, I think 2 years is probably a pretty safe bet. As long as you're compliant and wear your Invisalign trays, show up at all your appointments, 2 years is reasonable.
Okay.
3 years is definitely safe.
And for the actual expansion part, is that about how long would that take?
The actual expansion part, let's call it 3 to 4 months.
Okay. Yeah. Yeah.
From the day the appliance is put in to the day you stop expanding, 2 to 4 months, depending on how slow you turn it. And people are turning it slower and slower all the time. So I used to say a turn a day, but that's not always the protocol anymore. Sometimes it's less than that. So you can pretty easily get to 4 months, especially if you're not turning it every day.
Okay. Okay. Yeah.
Yep. Then you go in for your Invisalign scan, and then you wait for your Invisalign trays, and then it's all orthodontics after that. But you keep the appliance in as a retainer.
Okay. Yeah. And then you don't have to, obviously, like after you've done the Invisalign, the braces, will you be all right after that without, you don't have to wear an Invisalign or anything like that? Or
Like a retainer?
Yeah. Yeah. Do you need
No,
to
you'll always need a retainer.
Okay. Yeah.
Yeah, you'll always need a retainer. Even if that's like a fixed wire that's adhered to the back of your teeth, you'll need something.
Yeah.
And that's everyone. Your teeth will move without a retainer.
Okay.
But normally, patients will get that fixed wire, plus they'll get like a final Invisalign tray that is their final bite. And you can wear that for a while. You wear the Invisalign tray for a while, especially at night for like, let's say a couple weeks or a couple months to really fix your bite in after you stop. And then maybe after that, you just keep your wire in and you try the Invisalign tray every couple days or every week or two just to make sure it still fits. And if it stops fitting, that's a red flag. That means things are changing, things are moving, things are collapsing in, and you need to get back to wearing that tray more to hold things up for a while longer.
Okay. Okay. Yeah, no, I mean, I'm not, that's okay. I don't mind having to do that, as long as I've got the improvements everywhere else, it's a small price to pay, really.
Yeah, you have no choice.
Yeah.
You have no choice. No one wants their retainer, but it's just kind of like it's a pill you have to swallow.
Yeah, no.
Unless you want collapse.
No, yeah. I mean, I've heard about that. And does that mostly occur when people don't have proper tongue posture?
I mean, it certainly occurs worse in those people, but it occurs even in people that have good mouth posture.
Okay.
Yeah.
So just
the safe thing is to wear the retainer.
Yeah.
And again, you can get to the point where you experiment with not wearing the actual tray for longer and longer stretches, but the tray will keep you honest. If the tray stops fitting, then something is going wrong and you need to get back to wearing the tray more.
Yeah. No. Yeah. No.
Yeah.
Yeah, no, I mean, I don't, yeah, that's all right. That's all right. I don't mind having the tray.
Yeah. What's the hang up with the retainer?
I guess I don't know. Yeah, I just haven't had one before, so it's a bit of a different thing, for the rest of my life. But
yeah, you'll get used to it, man.
Yeah, I'm sure.
It'll disappear.
Yeah.
In the noise. You'll stop feeling it after a while. I mean, even the MARPE, which is this big bulky thing at the roof of your mouth, you even stop feeling that after a while. After a month or two, it's like it's not even there.
Yeah. I mean, I guess I'd imagine that would be the case. Yeah. I mean, I think even my sister, she wears a retainer as well sometimes. So, yeah.
Sure. Everyone who's had orthodontics has a retainer unless they stop wearing it.
Yeah.
And if they stop wearing it, it's usually not a good result. A couple months or a couple years later. I talk to people all the time who pull their retainers and end up crooked again. It happened to me. My palate collapsed when I removed my retainer after I graduated college.
Yeah.
It was a mistake.
Yeah, I mean, that's good to know. I mean, I didn't really know anything about retainers or anything, I didn't realize. it was it was an issue or it could cause issues and that sort of thing. But
Yep,
yeah, that's good to know.
for sure.
It's good to know. Yeah. But no, I mean, I was gonna start. Oh well, I was gonna wait until I finished getting the expansion and stuff. But after I finish, would it be okay to then do some more, like take up boxing or something like that?
Yeah.
And it would be all right. It wouldn't shift anything around too much.
No, you could even do that stuff after jaw surgery if you waited 6 to 12 months. The bone heals. The bone heals. The mid-palatal suture heals after you split it. And it
Okay,
heals hard as a rock.
that's
So you
good.
don't
Yeah,
need to worry about permanent limitations on your face after MARPE, or even really after jaw surgery.
yeah. There's
The
the
bone
other thing.
comes in and the bone solidifies the area.
That's good. I mean, I've broken a few bones before, so I mean, I think they've probably healed back stronger now that they've broken.
Same
Um,
idea, bro.
yeah, but that's the other thing as well. I mean, I know you said that my palate might be a bit weaker because I'm younger. It might be a little bit more malleable. But I think I've got pretty dense bones naturally. I think I'm pretty. I mean, just I don't know. I did lifeguard training, so I did train to be a lifeguard a couple of years ago. Um, and yeah, whenever I was the casualty, nobody liked that because I would just sink to the bottom of the pool.
Huh.
So I don't know. So
Why?
that's what,
You're
yeah.
just thick.
I think I've just got dense bones. I think it's just. My dad was the same. He couldn't do. He couldn't float. He just sank to the bottom of the pool.
You're like a piece of
Um,
iron.
yeah, I know, just like lead. Yeah, but so that was why I was thinking about obviously the cut to the top of the jaw.
Yeah,
And
man.
yeah.
You may be a good candidate for that.
hmm And would they decide? So if I went to visit whoever my provider would be, they would then look at me and take a scan and decide that whether that would be a good thing.
Yeah, the scan can actually tell you whether or not it would be safer to do a cut for someone as opposed to, or it can also tell you whether you might get away without doing the cut.
hmm
So the scan is the final piece of information that you need to make a confident decision one way or another. But it's always safer from an expansion point of view to do the cut.
Yeah.
It never hurts the expansion process to eliminate resistance from the mid-palatal suture. Now, it does pose other risks, but from an expansion point of view, assuming those other complications and risks don't manifest, it's always better to do the surgical assist.
Yeah.
It can only help. Because there's basically two variables when it comes to whether or not an expansion happens. Number one is the strength and rigidity of the expander. Number two is the resistance from the palate. So if you can reduce the resistance from the palate side of the equation, then you're just increasing your chances for success that a good split's going to occur. It's that simple.
Yeah. No. Yeah. I mean, that's what I want. Yeah. So, would you say then I should kind of push for that, even if they say maybe no, or just go with what the provider wants?
I don't know if I would push for it because I believe all of the doctors, I don't know about the UK doctors, but I know that Cimile, Moschik, and Cantarella, I believe they all do piezo assists, or they can put you in touch with a surgeon or a periodontist who does it. So if they give it to you as an option, I would go for it. But if they're like, no, Jacob, you really don't need this, I would probably not push back too hard against that.
Okay.
But if it's an option, I'd go for it.
Yeah, definitely. And would that cost more to do that, or I mean, again, cost it wouldn't really matter, but is it just part of the procedure? I guess
Sometimes it costs more to do that. If they outsource it to a periodontist or to a surgeon, it definitely costs more, usually $2,000 to $5,000 more. But if it's done in-house, like many orthodontists do it in-house, because the piezo tool is really not that difficult to use. You can learn how to use it to do a mid-palatal osteotomy.
Hmm.
Um, if it's done in-house, it usually doesn't add cost. They like it. They want you to do it because it just makes your case go that much smoother.
Mm.
But they're not going to disincentivize you doing it by charging you more for it. It's part of the treatment package.
Yeah. No, that's yeah. And oh yeah, also when the expansion's happening as well, like foods and stuff, like eating, what kind of do you have any issues, or do you get any issues with what foods you can eat and stuff like that?
Initially, eating anything is difficult.
Mm.
After you get used to the appliance being in your mouth for a couple of weeks, like let's say 2 to 6 weeks later, you can eat
Hmm.
whatever you want.
Okay.
Food will get stuck between the appliance and the roof of your mouth, but you just use a water flosser to knock it out.
Hmm.
Um, you don't want to water floss into the piezotome healing site. Like if you have the cut at the roof of your mouth, you'd want to make sure you don't water pick that,
Hmm.
because that can prevent the site from healing because you're washing away the healing cells and all that. But after the suture heals from the piezotome, then it's fair game to basically clean above the appliance with a water pick at, a decent pressure,
Yeah.
6, 7 out of 10 on the unit on the water pick. And that pretty much washes everything out. But you will need a water flosser with your MARPE.
Yeah. Yeah. Yeah.
But it's doable. I mean, when I had my MARPE, I ate my normal diet, like basically a lot of steak.
Yeah. 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 No, yeah, that was kind of a worry. I guess I was worried, you bite down too hard and it's gonna shift some stuff, but it's
No, 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 no. Biting
yeah.
forces are not going to interfere with the appliance or the expansion.
Okay, that's good. Yeah, yeah, yeah.
The forces we're talking about are way bigger than that.
Yeah. Okay, yeah, yeah. I mean, I guess yeah, they would have to be.
Yeah.
Yeah, yeah.
Although there's
That's
a lot of forces involved in biting, but chewing is not going to interfere with the expansion process. I mean, I wouldn't go out chewing mastic gum for an hour a day. I don't
mm-hmm.
even really chew any gum at all anymore myself. But apart from like going way overboard with chewing some really, really tough gum,
Mm-hmm.
you'll be okay. You can eat whatever food you want.
Would you recommend like chewing some tough like gum or whatever, like chewing chewy stuff, like after it's finished, like just for jaw health, or is
In
that
in in
overrated?
in super moderation. It
Yeah,
really doesn't do much for you, man.
yeah, yeah,
And in fact, it can do more harm than good.
yeah, yeah. That's
It
what
can
I've heard.
cause you
Yeah.
to get a clenching habit
Mm.
because you're just activating those muscles all the time, and then in your sleep they remain activated.
Yeah, yeah.
If you have any TMJ problems, it can exacerbate them. If your tongue is cramped inside your palate, even after an MSE, like let's say you need a jaw surgery because your tongue is trapped backward in the AP direction, the MSE doesn't help that a ton. And if your tongue is cramped back, it's really not healthy to use your tongue a ton because you're just going to irritate muscles at the back of your neck and give yourself headaches or
Mm-hmm.
other craniofacial pain. So, I mean, 15, 20 minutes a day max is what I would recommend of any gum chewing.
Yeah, yeah.
One
Okay,
or
yeah.
two pieces a day. I
Yeah.
am I am bearish on gum chewing at this point in my life. After all these years of doing a lot of gum chewing, I'm just not a big fan of it.
Okay, yeah. No, I mean that's yeah. I mean I've never really tried it or any of that sort of thing. I don't know. Because I would worry it would kind of like make my face a bit, too wide and, like, overstimulate the masters and stuff and make it look a bit strange. But
Totally, man. Yeah, you can very easily hypertrophy your masseters by chewing too much gum. I mean, I'm a case in point of that. I mean, I think my masseters are sort of starting to settle down because I haven't chewed gum in like a month,
mhm.
maybe a little bit more than a month even. But even as recently as a month ago, my masseters were super hypertrophied from chewing too much gum.
Yeah, no, yeah, no, yeah. I mean, that's good to hear. I mean, I was kind of thinking, yeah, you might have to keep some stuff up, but like it's just the retainer and the posture in your mouth and everything.
Yeah, just
Just the basics.
a nice gentle suction at the roof of your mouth as the default place where you park your tongue is going to be enough.
Yeah.
And just nose breathing, gentle tongue suction, and keeping your mouth closed when you sleep with decent tongue posture in your sleep. Those are going to be the keys to preserving your structure. You don't need to overdo it.
Hmm.
And then chew tough foods. You don't need to chew gum, but chew tough foods. That's plenty of stimulation.
Yeah, yeah. I mean, I know I have been keeping the tongue to the roof of my mouth. That is one thing that I have been able to, I mean, sort of do, especially in sleep. I mean, there is still a bit of a gap because of my palate. It is pretty high and arch, so it's kind of hard to fit my tongue up there. But
Right.
every morning or most mornings, I wake up and I've got, quite bad scalloping on my tongue, but that just means it was up there and my mouth was
Yeah.
shut.
Yeah, that's good. And I think the expansion will make it even easier for you to keep your tongue up there and hopefully with less scalloping.
Yeah, definitely. I mean, I'm trying to. I mean, it doesn't hurt or anything. It's just it looks kind of gross. Um, it'd just be nice to have my tongue fit properly up there.
Totally. Yeah, man. I feel your pain. I'm also lacking tongue space, but not so much in the left, right, more in the front back.
Hmm.
So having a lack of tongue space can be very frustrating for people who become aware of that.
Hmm. Yeah, I mean, especially, I mean, well, I guess when the whole rest of my life, it was just resting on the bottom of my mouth. And
Right.
it did take a lot of effort to manage to get it up there, but it is my resting tongue posture nowadays.
Because
Um,
you've practiced mewing.
yeah, yeah.
Good for you.
So I mean, even if it's not gonna give you the expansion benefits or whatever you might have as a young child, it's still good to have that with mouth breathe, with nose breathing and everything that comes
I
with that.
totally agree. I totally agree, man. Jacob, I've got to jump to my next call.
Hmm.
Um, anything before we wrap up here in the next minute or two?
I mean, like, yeah, I think I probably asked about all the questions that I was thinking about.
Yeah,
Um,
next step for you is going to be to connect with some of these doctors we talked about and see if you can find someone who's willing to take you on.
yes, definitely, yes, I will be looking into that as soon as possible.
All right, excellent, brother. And you reach out to me if you need anything further, okay? Let me know how it goes with you know, whether it's Cantarella, Most Chick Chimile, all three of them. Feel free to shoot me a message and let me know what the next step is for you.
Okay, yeah, I mean, thank you very much. Yeah.
All right, it's been a pleasure meeting you, Jacob. Okay, you're doing a great job, man. You're a smart guy, and very bold of you to come on here and willing to share this conversation on YouTube. Just keep going, man, and there's definitely brighter days ahead. Okay, brother, and enjoy yourself.
Okay, yeah, thank you very much.
All right, Jacob, take care, my man.
All right, bye.
Bye bye.